I think what people don't understand is that we don't, for the most part, most therapists are not designated to just one floor. Our
Okay.
ICU therapist usually is, but they also take care of like our ER. The other floor therapist will usually take care of two or three different floors. So you might not see them all day, but that doesn't mean that they're not working. It's very important to be a people person, to see things from every side, right? To be there for your staff members, to know that they can confide in you.
Today, I will be interviewing Dulce Noriega, who is a cardiopulmonary director. Hi, Dulce. How are you? Thank you so much for being here today.
Yes, of course. Thank you for having me. I'm really happy to be here.
Yeah, of course. We're super excited to have you on. So, we're just going to go ahead and jump straight into our questions today. Three questions that we always like to start off with are one, in your own words, what do you do? Two, where do you live? And then three, as a kid, what did you want to be when you grew up?
So I am the cardiopulmonary director. I currently overlook four different departments. I overlook the respiratory therapists, the echocardiographers, the EEG techs, and the EKG techs in my facility. I'm from Bronzeville, Texas. As a child, I actually didn't even know about this career. I didn't know about being a respiratory therapist, what other healthcare professions there was out there. So when I was younger, I actually wanted to be a forensic pathologist. That was really intriguing to me. But unfortunately, there was nowhere in our area that held that career.
Forensic pathologist. Wow, that's
Yeah.
interesting. And then how long have you been working in the field as a respiratory therapist?
So I've currently been on the field for 13 years.
Wow, 13 years of
Yeah.
experience. That's
Yeah.
awesome. What made you want to get started in this career path and how did you kind of get your start?
In the very beginning, I actually went to school for X-ray technician. I didn't know so much about the respiratory field in itself. I kind of knew about it, I had heard about it, but I didn't know too much information about it. So I went into radiology. I was in radiology for about 4 years. I knew I wanted to do more. I knew I wanted to be involved more in the patient care aspect of things. Um, and what better way than to help patients breathe better? I think that's the core of life. Being able to breathe, having that feeling that you can take a nice deep breath. So I looked into the career path. I actually had a friend that introduced me to it, and it kind of took off from there.
Wow, that's awesome. Did you go to school for this?
Yes, I did go to school to become a respiratory therapist. There's two different levels. There's a certification level and then a registry level. So the certification was 2 years, and then to become registered, it was another year.
Got it. And then are there any other titles that this job goes by, or is it primarily just respiratory therapist or cardiopulmonary director like yourself?
So there's a certified respiratory therapist, which is a CRT, and then the registered respiratory therapist.
Got it. So now kind of walk us through a day in your life as the cardiopulmonary director. What exactly does your day look like from start time to end time? And then kind of what are the tasks that you do in between?
So daily, when I get here, the first thing I do in the mornings is I look at our timesheets. So people clocking in and out for the day, I need to make sure that everybody's hours are correct, of course, to make sure that they're getting their paycheck, right? But we also need to
Right.
manage those hours in the facility to make sure that the productivity that we have, how many patients we have, is matching the amount of therapists we have on staff. So I'll start off with that. I'll look at everybody's time clock. From there, that'll usually take me about 30 minutes to an hour. From there, I'll go over to the ICU. So every morning we have what is called multidisciplinary rounds. So we meet with the physician, with the
Mhm.
nurse, the respiratory therapist, the who else is there? Pharmacy is there, lab is there, infection control is there, the manager for the ICU is there. So we'll go patient by patient, discussing exactly what we need for those patients in order to get out of the ICU and out to the floor. Um,
Got it.
Depending on the amount of ICU patients that we have, that takes about an hour and a half or so. From there, we'll discuss all the patients, what the plan of care is for every single patient, matching the orders of whatever that the patient is on is exactly the order that we have in our computers.
Hmm.
Touching base with the respiratory therapist if there's anything else they need. Because it's also, we take a look at everything, right? We're looking at the, if we're managing a ventilator patient, make sure everything is connected correctly, making sure we have suction equipment, making sure everything is as clean as possible, throwing out any old equipment that we don't need. So it's a pretty much top to bottom look of every single one of those ICU patients.
Got
From
it.
there, I'll come back to the department. I'll check on the staff to see how everybody is doing. I'll check in with my manager, with my supervisor, if there's any reports that we need for quality presentations and things like that. I'll work on that for a while. At 11 o'clock, I'll head over to the boardroom, our boardroom. There we meet with the other facility directors. So every single morning at 11 o'clock, we all meet to discuss what's going on around the hospital. So,
Mm.
and sometimes that's when the communication comes, hey, we need this from your department, we need that from your department. This is not going as well. What can we do to fix it? So that is called safety huddles. So every morning at 11, we meet for safety huddles. Every director goes around discussing what is going on in their department for the day. If we need anything from another department, our HR department is also there, our quality department is there, our administrators are all there. So it's a big team effort and collaboration of seeing what we need to do in the facility, what we need to improve on, or just what events are going on. We have a lot of events going on in the hospital, you know, to show also employee appreciation, to make sure that we're engaging with our employees. So that's usually around 11 o'clock. Then depending on the day, sometimes I have meetings, sometimes I have interviews, sometimes I'll be able to take a lunch during that time after, like around 12. I come back at 1 o'clock. At 1 o'clock, I meet again with our case management team, the same team we met with earlier at 9 o'clock, but now we're meeting in a boardroom and we're discussing the rest of the patients in the hospital. So what do the rest of the patients in the hospital, what do they need to be able to, in order to go home? The intensivists, and our hospitalists will go in, we'll discuss all their patients. Case management is then discussing what the discharge plan is going to be. How do we discharge our patients safely? What do they need from respiratory? If they need to do a walk test in order for them to go home with oxygen. If they need instructions on how to suction a patient or how to do trach care on a patient, we'll start discussing all that during that 1 o'clock round. So that's again multidisciplinary rounds at 1 o'clock. At 2 o'clock, I'll come back to the department, check on the staff again. And then from there, I'm usually working on paperwork depending on what I need to do for about an hour. At 3 o'clock, I'll go out, I'll start rounding with the staff members again. Usually they're on their last round of therapy. So it's just kind of helping them out to see what else they need to do in order for them to finish the round so we can start kind of closing up the day a little bit. If I need to order equipment or we're running out of equipment, if I need to look for supplies, if we need to order supplies, if we need to order pretty much anything kind of goes in that afternoon round. If I need to have a report for physician, we have radiation badges that we use. If I need to pull those reports, so because I need to report that to a committee as well. So pretty much just kind of wrapping up the day and seeing what else we need from that 3 to 5 o'clock. My day does end at 5 o'clock because I am one of the directors, so I'm here Monday through Friday. But does it always end at 5 o'clock? Not always, right?
Not
Um,
always.
not always. And of course, we're as directors, we're on call 24/7. If somebody needs something from us, we're always available. We're a phone call away.
Wow, that sounds like a packed day. I feel like you lived a whole week and that just 8
Yes,
to 5. That
yes.
is crazy. So a lot of multitasking. Do your
It
days
is.
kind of always look the same, or is it always a different day whenever you go in?
Especially here in the hospital, it's very different. And especially because since I have 4 different departments, it's not just the respiratory staff that I'm in charge of. It's also the EKG tech. What does he need if he's having any issues with patients? Sometimes even if they need medical records and the staff is backed up, like I'll help them out with that. our EEG techs as well. Sometimes they need supplies or whatever they need. Our echo techs are very, very busy department.
Mhm.
Because there are only two echo techs. Sometimes they're calling them from the outpatient lab. Then we have floor patients that are pending to discharge to go home. And then we have our OR that's calling because they need a preliminary report before a patient goes into surgery. So it can get very hectic, but you really have to have a passion and a lot of patience
Yeah,
to be able to do this.
I
Yeah.
can see that. Just kind of being pulled wherever you need to be. That's
Yes.
kind of the majority of your
And
day,
then
just going to different
sometimes
departments.
just the people part.
Mm,
Sometimes people just want to talk, right? Sometimes they just want an ear. They just want to come into the office and have a chat, and that's very important too, because it's very important that you establish that rapport, with your staff members, so they can feel that they can come to you whenever they need you.
yeah. What tools or technologies do you use as part of your job?
So as a respiratory therapist, 'cause that's my core, right? Job, we handle anything from nasal cannulas, venturi mask, non-rebreathers. We go into the machines where we use a BiPAP machine, we use ventilators, we use suction machines in case we have to suction patients. We do use bronchoscopy machines, or bronchoscopes where we go in and do lavages of patients' lungs.
Okay.
um yeah, pretty much things like that.
Yeah. And when it comes to your job, what parts of your job are the most exciting or rewarding to you?
I think it's definitely being able to discharge patients home, seeing them come
Hmm.
in, like if it's a motor vehicle accident, if it's a patient that might have coded somewhere, and kind of seeing that recovery of the patient from top to bottom, or from bottom to top, right? From where they were to where they are now, to be able to discharge and send them home. um And unfortunately, there's times that we don't get to send patients home, right? But then there's also the beauty of like organ donations and how a patient can impact other family members. Sometimes 15, 20 family members from different organs that they donate, and people being so grateful. And sometimes we don't see that right away, but we like to do a lot of recognition for those type of patients, because let's say a year later family members will come back and we'll do a reunion, right? And we'll get to see where like that donation went to whose family members and how they benefited from it. um so it's always very rewarding no matter what we're doing here.
Yeah, I'm sure kind of just getting to witness that must be so rewarding and make you so proud. Now, talk to us a little bit about the hard parts of your job. What parts are emotionally challenging, draining, even sometimes boring, things that you don't necessarily enjoy doing? What are the more negative sides of being a respiratory therapist?
Of course, it's when we don't get to send those patients home, especially um, babies, pediatric
Mm.
patients. I think that's definitely one of the hardest things, especially at least for me, right? I can be in the moment doing what I need to do when the patients come in through the ER. I'm so focused, right, on doing the best job that we can do. But once we call a code like that and hearing the family members, the mother, the dad, the grandparents, just let out that cry, that is one of the biggest heartaches you can ever endure. I think there's nothing that's harder than that. Um, and then pandemics.
Mm.
We went through this whole COVID-19 pandemic that was one of the biggest um, things that has ever happened in a lot of our careers. It wasn't easy. It wasn't easy because no matter how hard we tried at the time, no matter what we did, um, it was futile. We couldn't help out patients. I mean, we had therapists here, everybody would be picking up shifts, everybody would be doing their part. We there I remember there was days where we'd go from one patient to another patient. Hopefully we never get to see anything like that, at least not in our lifetime. But there's being trying to do your best and it not being enough, no matter how hard you try, can be very emotionally draining. Definitely.
Yeah. I can imagine. Talk to us a little bit about the COVID-19 pandemic, and how do you think that affected your specific industry? Because, that was an illness that was targeting people's lungs at one point.
Right.
So what did that look like for you? What was that time period like?
In the very beginning, I remember a lot of the therapists here wanted to go out and help, wanted to go to New York, because that's where like it was all going on. It hadn't really hit
Mm,
us down here.
mm,
So everybody thought like, nah, it's never gonna happen here. It's going on way on the other side of the country. And then you started hearing about the shortages in supplies and gowns and masks. So a lot of the therapists started ordering their own masks, ordering their own supplies. It's like, okay, we're gonna pack up our stuff so we know we have enough equipment for ourselves, and then we'll go out and help, right?
mhm.
um by the time we received our supplies, it was hitting us. It
Wow.
started to hit us. There was no, it was weird because we didn't have other patients. We didn't have our regular COPDers, our dialysis patients. Our hospital completely became a COVID facility. No matter where you went, every single patient in our hospital was a COVID patient. The floors, the ICUs, our OR rooms, our ER, and day surgery, we would never really have patients going, getting ready to go into surgery. We didn't have day surgery patients. We weren't doing surgeries. Um, we had COVID patients in those areas. Um, so it kind of just hit us out of nowhere. In the very beginning, we didn't have outside staff, outside agencies, because they were out helping out other facilities. So all we had really was ourselves, our own team. And our team did an amazing job at pulling together and really coming in. And every shift would pick up on the opposite shift because we knew that if we were alone, like we weren't going to make it. And it was hard because sometimes, like I said, no matter how hard we tried, and it was like a horror movie. We would go from one code to another code to another code, pretty much all day. And it was hard because back then all the doors were closed. We didn't know what was going on behind the doors. Patients would remove their oxygens. By the time we would come in, we would find them laying on the ground. You know, it was very hard. It was very hard. Once the vaccine came out, that was really our little glimpse of hope.
Mhm.
We had to kind of be those guinea pigs to say, we're going to take the vaccine because that's all we have. We don't have another choice. We just have to hope for the best and hope it works and see if everything turns around. So as being in the healthcare, our family members, our friends all kind of look to us like, let's see if you guys take the vaccine first. And then if you do, then we'll do it too. Right. And it was an unknown of the vaccine too, what was going to happen. There's people who were having reactions to the vaccine as well, but what was going to be better? I mean, some people having a reaction or really completely hoping to take over this COVID pandemic and changing it all around. And thankfully it did help us out.
Yeah, I can't imagine how hard and traumatic that time was for you guys and all of healthcare in general. So, on behalf of the entire world, thank y'all so much for what you did
Of
during
course,
that time of
yes.
the pandemic, because healthcare really were, some heroes during that time.
Yes, thank you.
Are you able to leave all your work at the office, or do you ever take some home?
I've always believed at least in a 70-30 work-life balance, right?
Okay.
I love my job. I love what I do. But it's still very important to disconnect, to be able to enjoy your home life and your family and your kids. Um, because that's always going to be number one, right? You hope your job will be there, right? And you do have to take care of your job. As a director, unfortunately, yes, we have to be available for our job whenever they need us. Um, that's our responsibility. That's what we signed up for. And if you're in that department or you're in that role, then you know that you have to respond when there's an emergency. And because we understand that this is our calling and this is what we love and this is what we like to do, it's not a burden to us either. For the most part, we want to be there, we want to help, we want to be there for the community. Um, so we try, everybody tries, right? But it is still very important to disconnect because especially physically, mentally, it does take a toll. And sometimes, yes, you're lying down and you're thinking about, oh, what do I need to do tomorrow? What do I still have pending?
Yeah.
Um, and I think that would be any job. I think that would be any job.
Yeah, balance is key in any
Hmm.
job, especially in healthcare. As
Definitely.
a respiratory therapist, are you able to work flexible hours in either a remote or hybrid setting, or is it usually more common to work set hours in office?
As a respiratory therapist, depending on what you want to do in the hospital setting, you usually do 3 days and then 4 days in opposite shift. If you're a full timer, then of course there's night shift, day shift, just depending on what the availability is. You have PRN positions. The PRNers kind of give their days whenever they're available. Um, and then you have other settings. I mean, like you have other jobs, office jobs like myself, like a director, a manager, that they're more Monday through Friday, 8 to 5. Um, just depends on where you go.
Yeah, so once you kind of get to your director, it's a little bit more administrative tasks, in
Correct.
office, having people under you. I'm
Yes.
guessing it just kind of depends what level that you're at.
Yes, correct.
Are there any busy seasons in this job? And if so, what parts of the year do you typically see start picking up a bit more?
So our fall season is definitely our busiest. We
Mm.
start seeing RSV, like in pediatric neonatal patients. And then, of course, you have your typical flus, your colds during the fall as well. So that's usually when we pick up the most. Usually by late August, early September is when we really start to see that pickup. And it'll
And do you
last usually about until February.
Oh, wow. So kind of through the entire winter, fall
Yeah.
through the end of winter. Do you
Yeah.
treat patients of all ages?
Yes. So here we see neonatal, pediatric, adults. We see everyone.
Got
Yes.
it. What do you think that people underestimate about this profession?
I think we've always been the other right hand of the physicians. Of course, you always have your physicians and you have the nurses, right? They're the right hand man. But when the patients really start to desat and they start getting into trouble, we are the other person that's always there. Everybody's like, where's respiratory? And we're there already. We've been bagging the patient. We're right at the other side of the bed and right there with the physician, right there with the nurse. Um, so I think people underestimate that, yes, we just take care of, the airway, but we're always there to help. If it's turning a patient, even helping to clean patients, to as translators, I mean, we do what we can and we're always available for the other staff, not just nurses, um, to also lend a hand.
Yeah, kind of being that default, always there, ready to go,
Yes.
never gonna fail.
Yes.
Now, what do you think that people overestimate about this profession? So this can be like an overhyped assumption, either positive or negative.
That we don't do anything. Like, that that we just come out like whenever there's a code or um and I think what people don't understand is that we don't, for the most part, most therapists are not designated to just one floor. Our
Okay.
ICU therapist usually is, but they also take care of like our ER. The other floor therapists will usually take care of 2 or 3 different floors. So you might not see them all day, but that doesn't mean that they're not working. That just means
Mm.
that they might be taking care of another patient, another floor. But they will come out and they will be there when you need them to be there.
Yes, and there's always something happening behind the scenes. So you
Oh
guys
yes,
are
that's
kind of
right.
always working. People don't
Yeah.
necessarily get to see that because they're not in that side of it, but,
Right. They're in their
always working.
floors, but we're in other floors and they don't even know it. Hmm.
Exactly. What is the fastest way to get into this profession? So especially if somebody has a non-traditional background, they're looking into starting, to get into this industry and work their way up to a director like you. What do you think is
Hmm.
the fastest way to get there?
Um, I worked myself up pretty fast. A lot of the
Okay.
therapists that were here before me have been here 20, 30 years. I've been in the facility, yes, 13 years now, but I was a regular therapist for about 4 or 5 years. After that, I became supervisor. I was supervisor for about 6 years. I ended up being a manager for a year and then moved over to my director role. Um, it's very important to be a people person, to see things from every side, right? To be there for your staff members, to know that they can confide in you, to develop a good rapport with your physicians, with the nursing staff, with the cleaning lady, with everybody, with your administrators. You have to be that hungry, like, yes, I can help you. How can I help you? And if I don't know how, like, I'll figure it out, you know.
Mhm.
Because at one point everybody's going to need your help as well, right? And it's important to have that open relationship and that open door policy, right, for people to be able to feel comfortable to come to you. So I feel like I can go into any single department around the hospital, if it's the OR, if it's the ICU, the nursery, the floors, and I can ask something from them, but because I also produce something back for them, right? They know that they can come to me and return if they ever need anything. Um, so it's very important to establish good relationships with people,
Yeah,
and then ask
100%.
questions. Yes, ask questions if you don't know the answers to them, or find somebody that can help you. And for the most
Mhm.
part, people will be willing to help.
Because you have so much exposure to different departments within the hospital, what fields do you typically see other people coming from whenever they come into the respiratory therapist industry or cardiopulmonary industry? What fields do you see people usually coming from?
Hmm. It's strange because I think I've seen a lot of people that come from like the food industry. I was in the food
Oh,
industry way back then. Um, but a lot of people usually get referred to this profession. A lot of people don't know about it. Usually they know somebody who's a respiratory therapist, and like, oh, I didn't know there was that career pathway too, let me look into it. But I think a lot of the people that are here have actually come from the food industry. um there's a couple mechanics even. I think that there's a lot of
wow.
car guys, a lot of car guys.
How interesting. Why do you think the food industry? Is there any like correlation or theme behind that, or is it just kind of random?
I don't think so. I don't know. I don't know. But now that I think about it, it's, yeah, I was like, a lot of people have worked at different food places here. Um, I haven't seen anybody like usually your CNA or your medical assistant or PCTs. Yeah, they're usually ones that transfer like into the nursing field. Um, we don't see a lot of those that come into respiratory. I'm not sure why. I guess because when they do clinicals and things like that, they just kind of expose them mainly to the nursing departments and not so much to the other parts of the hospital. Um, but we're food people and we're foodies. It's true.
That's too funny. And I like that you mentioned earlier that, not a lot of people know about this job. It's usually something that you have to get referred to or you have to kind of know somebody within the industry. That's essentially,
Right.
what this platform is for, just to kind of expose people that this also exists. And if you have an
Exactly.
interest, this might be a good fit for you.
Yes.
What does someone have to be really good at and enjoy doing to be successful in a role like yours?
That the people person, I think it's the people person is key. Communication is key. Being organized as much as you can be. I mean, it's hard when you're multitasking, but making sure you kind of keep some kind of organization to make sure, okay, you close the loop on things, because you might be working on one thing and somebody comes in and they're asking you for something else and you're like, okay, where was I? Or, um but also, like you said, the disconnecting part, because
Mhm.
if you can't go home and disconnect, you're going to come right back feeling just as tired, just as beat. But making sure you put self-care into your routine. How else can you, because it is very important, because people will burn out. And I think in the past there's been like, I think when since I've been here, I've gone through 4 or 5 different directors, where most of them
Wow.
don't last more than like 2 years. Um, And because it can take a big toll on your person if you don't know how to disconnect.
Wow, I'm really glad you bring up that point because like we were saying earlier, balance is key. You don't want to burn
Yes,
out and then end up having to leave your job after, a short time because you weren't able to
exactly.
disconnect and take that time for yourself.
Yes.
You've been in this industry for 13 years. How long do you think that it typically takes for somebody to get really good at what you do? Or you can speak from personal experience. When did you kind of start getting comfortable within your role?
I think everybody always continues to learn, right? And then sometimes it even gets to the point where people become too comfortable with what they do that they don't put work into the detail that they're supposed to do. They just kind of go through the motions of the job.
Mhm.
So as a director, it's still very important to kind of keep everybody aligned to where, hey, don't forget, yes, we're supposed to be doing this, but don't forget you're supposed to be doing this as well, right? Let's say we're running some blood, right? And we have to report the results. Okay, you have to put what time you ran the blood, who you reported to, what the settings were on. It's just all those little detail parts. Or when you're giving a patient a medication and you have to scan a patient, we scan patients here, right? So we don't give a medication to someone that it's not supposed to be them. And sometimes the scan doesn't go through correctly. Oh, the scan didn't go through, but I still documented it. It's like, no, you need to make sure you're doing it. So just kind of always finessing our job and what we do and making sure that we don't drop the ball. This
Mhm.
isn't your typical like job. It's a very important job where we have patients, their health on our hands, and it's very important that we're doing everything correctly like we're supposed to do. Or even a ventilator, when we have our vented patients that they're supposed to be on certain settings on the machines, and sometimes the physicians will come in and they'll move the settings, or nursing. Oh, I mean, people will come in and just suddenly there's different settings from whatever's on the computer. Now, as a therapist, it's very important for you to go back and make sure that whatever settings are on the machine are the same settings you have on your computer on your orders. Why? Because you have to protect yourself, right? You have to protect yourself. You have to protect your license, because if something happens for whatever reason, and those settings are not the ones that are on the orders, and that's what you're documenting, that's your license on the line, right? So it's little things that, yes, people are very busy. Yes, we get busy, but it's still very important to go back and look at those details.
Exactly. And like
Um,
you said, you guys have lives on the line. So it
right.
is important to, not get too comfortable, kind of go through the
Yeah.
day, but go through it alert.
Yeah. So I mean, it's things that even if you're an amazing therapist, you could be the best therapist out there. Um, every year we still have to do education. We have to do yearly competencies for that same reason. And sometimes people end up getting too comfortable, and we just have to have that reminder of like, hey, this is what we're supposed to be doing, and this is the correct way to do it. Don't take shortcuts. This is not the place to take shortcuts. Like, this is very important.
Yeah,
So
exactly.
it's always a learning and growing every single year. So are we ever going to perfect it? It's tough to say.
But like you said, just continuing to learn and to grow and, expand your knowledge as a respiratory therapist each and every day.
Yes. And then there's always technology.
Is Yeah, as well. Is there
Mhm.
a promotion path when it comes to your profession? And if so, what does that look like?
So I think the bottom tier would probably be maybe our PRN staff. They come in, they work whenever they can. They do actually get a higher pay than our regular therapists, only because they don't get the benefits that a regular therapists do. They don't have the healthcare benefits. It's just a set regular pay. They do have differentials, like if you work night shift, so you'll get maybe a dollar, $2 more, depending if it's a night shift, if it's a weekend shift, things like that.
Mm.
From there, you'll go into either a part-time or full-time therapist. The part-time therapist is only guaranteed pretty much about 20 hours a week, while the full-time therapist is guaranteed from 35 to 40 hours a week. They do get benefits. They get vision, dental, um, 401k, and then um, they're at a different tier. They're at a lower tier than our PRN staff, but because they have those included benefits. From there, we have supervisor positions. Their pay is the same. They get the same amount of benefits as a full-time, part-time staff, but their pay is a little bit more. Um, And then from there, you have your manager, another tier, higher pay, same benefits as well. And then you have the director position. And then
Got it.
that's, of course, the highest.
So you're at the highest role within your profession right now, cardiopulmonary director.
Yes, yes.
Awesome. When people in your field move on, what do you see that they typically go into? Is it random, or again, do you kind of see a theme of people usually moving on, going into a certain industry or certain profession, or do people typically, retire and end their career in your position?
The ones who do end up moving on, if anything, they'll go into teaching, but teaching like healthcare professions. A lot of them have gone into like high school, teaching PCTs, bringing students into the facility and doing clinics, like clinical rounds. Those are the main ones that I see. So you still stay in the healthcare field. A lot of them feel comfortable because they've already worked at the facility. So they bring in these students, they know everybody in the facility. So it's easy for them to pair the students with different staff members. And there's a lot of therapists that end up retiring from here. We have a lot of older therapists in our department, not older, too far older, but this is kind of their home. We didn't lose a lot of therapists during COVID, at least in my facility. I think we maybe lost 2 or 3, but everybody else has pretty much stayed here. From a lot of the feedback that I've gotten, I mean, they plan to retire here. But it's still very important to know the facility that you want to go to or where you work, that you have a good culture, to be able to feel comfortable enough to say, you know what, I think I want to retire here. Like, I'm happy here. I love working here. I love my coworkers. So a lot of people end up retiring where they're at.
Yeah, kind of just, like you said, just being comfortable around the people, your facility, being comfortable in what you do. I'm
Yeah,
sure that keeps them there, within the position, or if not, ready to enter and transition into the next phase of teaching what they know. So
right.
either kind of teaching or, usually just staying there and continuing on.
Right.
When it comes to salary, what is the average salary of someone at your position? I know it can vary, state to state or different facilities, but if you could provide a range, even if that's a broad range.
I want to say for my role, it's probably about 100,000, maybe entry level directors, all the way to maybe 150, 160,000 a year.
Wow. And
Yeah.
then for respiratory therapists, do you know what that looks like?
Uh, Certified respiratory therapist is probably about 70 to 80,000, and then registry about 80 to 90,000.
Okay, good to know. Are there any books or resources, programs, certifications that you can think of that you would recommend to someone wanting to get started as a respiratory therapist?
I think to this day, from even back in the day, the catering seminars have been a great help, and then Lindsay Jones. Those are two of the main pretty much work studies, or like studies that we use in order to take our exams.
Got it. And that's something that you would recommend to anyone kind of wanting to get
Yes,
started.
yes, catering and Lindsay Jones for sure.
Awesome. Well, Dulce, you have provided such amazing advice and knowledge and insight of what it looks like to be a respiratory therapist or a cardiopulmonary director like yourself. To kind of wrap up our conversation with our last question, if you were to tell your younger self at the beginning of your career, what would you tell her if you were able to do that?
You have no idea the ride you're about to go in, but it's well worth it.
That's awesome. Well, Dulce, thank you so much for your time today, for giving us, a part of your day. We know that you have crazy days full of different activities and different tasks that you have to be at. So we do appreciate you taking the time and coming to share your knowledge with us on the show today.
Yes, of course. Thank you so much again for having me. This is amazing. I'm glad you all are doing this. So much luck to you all.
You just got one episode closer to learning about the world of jobs out there. To explore the rest of our career categories and find your best fit, go to jobdictionary.com to sign up for the beta users waitlist. Then subscribe here to find the next episodes coming out this week. And as always, drop us a comment, review, or message to let us know how we can better attune our episodes to your specific needs. Follow us on TikTok, Instagram, Facebook, LinkedIn, X, Threads, Pinterest, and wherever else you're on socials to go get our short, snappy preview reels that expose you to new job options every day. Because here at Job Dictionary, we believe your big aha moment can be just one scroll away. Go check it out and get out there. Cheers!